Today's episode of Knoxville Medicine Doc Talk is sponsored by London and Amburn, Attorneys at Law, Healthcare People, Healthcare Law. London and Amburn, Attorneys at Law, are proud to support the Knoxville Academy of Medicine and its mission to continue to improve community wellness in East Tennessee.
Hi, welcome to Doc Talks, where we talk about plain talk in plain language about different diseases that affect all of us in Knoxville and East Tennessee. Welcome. I'm Elise Denaney, former president of the Knoxville Academy of Medicine, and your hostess today to talk about asthma. Today we have Dr. Marty Prince from Stat Care Pulmonology Group, Pulmonology. He'll explain what that is also, in Knoxville to talk about asthma. Not only he's an excellent lung doctor, but he also is an excellent musician. Really true. His group is called Remedy. He may not like me bragging about that, but
no, we love that actually.
Really
It's we like you bragging about it.
See them on Facebook. You need to go hear their gig and their set.
Thank you.
So,
thank you very much.
You're welcome. Welcome, Marty. So, what's asthma?
Asthma. Asthma is a common disorder that is a lung disease. It's an inflammatory disorder. The lung is inflamed with a type of cell called an eosinophil that is associated usually with allergic disease. And it's manifested with fairly common symptoms, episodes of wheezing, coughing, sputum production, and being short of breath. It occurs in all segments of the population. More common in allergic disease than non-allergic disease, more common in younger people, but can still occur in all sorts of different population groups. One of the disorders that we most often see in our practice taking care of people who have lung problems.
You know, asthma, I try to run. I'm not very successful running. After about a quarter of a mile of running, I get short of breath, I'm coughing, not wheezing, but I don't think that's asthma.
Usually it isn't, but asthmatics, certain things trigger asthma.
Sure.
Exercise is one of those things. People who are asthmatic will have difficulty with exercise, with cold air exposure sometimes, with bad air days when we have pollution in the air, and other triggers like pollens or dandruff from pets and those sort of things. Not everyone who has asthma has an exercise component to it. So lots of people, if you're not running much, you go out and run, you may get short of breath. The majority of people don't develop chest tightness and wheezing and coughing, particularly after they stop exercising, which asthmatics do.
Okay, so it's inflammatory. That means that like my windpipe and those passageways into my lungs, that when I get triggered by something in the environment or pollution or whatever, my lungs close up, my passageway closes.
They narrow.
They narrow.
What happens when airways are inflamed in asthmatic patients? The breathing tubes become narrow because they chronically become more swollen. They make more mucus, and they are twitchy or overly responsive. So normal people go out as the weather's getting cold this week and get a lung full of cold air, and it may feel uncomfortable, but you don't start coughing and start wheezing. So asthmatics have more symptoms because their airways are sensitized and tend to be narrow already, and then they become bronchospastic or twitchy, and they close when they're exposed to certain triggers.
And then you feel like you just can't get a
then you
breath.
Have difficulty with your breathing. More commonly, asthmatics will tell you they feel like their chests are overinflated because they can breathe air in, but trying to get the air out becomes a real problem, and it gets stuck or trapped in there, and the faster you try to breathe, the worse that gets. So asthmatics develop the sensation of a full, tight chest, and they can't get the breath out.
And panicking can make it worse.
Very panicking can make it worse, and unfortunately, breathing quickly makes it worse. It's important to try to recognize those people, diagnose them, and then spend some time not just treating the disease medically, but trying to outline ways to avoid things, ways to avoid episodes being triggered, and teaching patients strategies for dealing with their episodes without having an ER trip for every little exacerbation.
Yeah, I'll bet the ERs see a lot of it because, and we can prevent that with, really understanding your asthma and what triggers it. So you run a bunch of tests to figure out what my triggers are,
Right.
what makes me get asthma, and then how do I treat my asthma?
Well, once we define your asthma, and that gets done basically with two things: a history from you, and then I'll make you blow in the machine. You blow in a machine, and then after you blow in the machine, we'll give you a medication, it's a bronchodilator, and then you blow in the machine again. And if you have asthma, you won't do so good the first time, but after taking the bronchodilator, you're better. And that kind of defines the disease.
Okay.
Once we define the disease, we need to treat asthma. The problem with treatment over time has been most patients will take a bronchodilator. And historically, until a few decades ago, that was mostly what we had to treat the disease. It treats the symptoms, but it doesn't treat the inflammation. So the key component to treating asthma is to use anti-inflammatory drugs to calm the inflammation down and stabilize the disorder. Inhaled steroid-type drugs are what we need to be using. Now, people hear that, they immediately don't want to take those drugs because they associate steroids with people who use steroids for bodybuilding or for other athletic purposes, or that the steroids will make them get fat or have diabetes or other things. The inhaled steroids don't really cause those sorts of problems.
Sure, right. Totally different way of steroids.
Yeah,
right?
because it is delivered to the airway and not into the body systemically. So you don't put much of that, most of that drug doesn't get into the rest of your body to cause all the bad side effects that steroids can cause.
Right, and just like any drug, if used properly, it's a good thing. If used improperly or abused, it can be a very bad thing.
That's absolutely true. The big problem we have with most asthmatic people is that they have to take their inhaled steroid medication routinely or it doesn't work. And most people will opt, because some of these medications have significant cost, they'll sometimes self-select to take a bronchodilator, but that in the long term makes things worse because you end up having more flares, more exacerbations, hospital stays, and we just need to make a real effort to inform and educate people about the importance of taking these medications to control their asthma rather than being reactive to an attack after it's already happened.
Right. It's kind of like when I see people, they just take the antibiotic until, oh, I feel better, so I won't finish it.
Yeah, exactly.
Not such a great thing. So going the cheaper way actually is more harmful to your windpipe and the tubes in your lungs.
And actually, it's only cheaper in the short run.
Yeah.
Because if you have to go to the hospital for your asthma, you could have bought several years' worth of your control medication with what it will cost you to pay for that hospital stay.
Okay. People generally, don't they know what their triggers are?
Most people do, but you have to ask. Some people, you really have to be. You have to be a little insistent on asking.
Okay.
People have a good way of denying things. For example, activity. Many asthmatics will tell you on first encounter, I don't like to go hiking. Well, really what they're telling you is, I don't go hiking because I wheeze and get short of breath when I go hiking, and they've learned that over time. They don't like to go hiking. So you have to sort of tease that information out. But once you identify those things, whether they have a cat that likes to sleep in the same bed with them, or they have a certain tree in the yard they're allergic to, that you can help modify their exposures and decrease their chances of having bad episodes.
And that's why, is that why, asthma and allergy go hand in hand, and
Yes.
we have to watch pollen counts and all of that stuff?
The majority of people who are asthmatic are also allergic, so it absolutely goes hand in hand. Not everyone. Some people are non-allergic asthmatics, but even they will have certain triggers. It'll be something that's not an allergen. It'll be an odor or an environmental thing that triggers them instead. But having the ability to define what those things are, and if they're allergy related, avoidance or certain treatments to deal with the allergy can make the asthma control a whole lot better.
So people shouldn't be scared about finding out if they're asthmatic or not, because there's a whole range of severity of asthma. It's not like if you're diagnosed with asthma, you know you're going to have to be on an inhaler.
Absolutely. There's a range of people who have severity, and it's just the opposite. People need to identify if they have the disease. The great majority of asthmatics, treated appropriately, they function normally. A number of people are elite athletes who are asthmatic, and they function at way higher than average levels despite having a significant disease because they use something to control their disease on a daily basis. It's the people who don't identify the disease and are treating themselves with episodic therapy who have their lives disrupted a whole lot.
If mom and dad are asthmatic,
You have an increased chance of that.
I have an increased chance.
Asthma is not inherited in a predictable way. It's not like certain other diseases, but it is definitely a genetically associated disease. And people who have asthmatic parents or asthmatic other family members have a substantially higher risk of being asthmatic themselves. Same thing's true for allergy. People who have allergies, if their parents are allergic, they have a high risk of being allergic and having asthma.
If you're asthmatic, probably shouldn't be around smoke.
Tobacco smoke's a real problem. It is a trigger for most asthmatics.
Okay.
And asthma is a common disease, so there are lots of people who have asthma who smoke. They tend to be harder to control and tend to develop progressive or worsening asthma at a more rapid rate than asthmatics who don't smoke. And it's true even for little kids. If they have a smoking mom, it doubles their rate of having asthma later on. Passive environmental smoke exposure also increases your risk of developing asthma.
Okay, so asthma. It's a disease of my airway. Lung doctors take care of it.
That's right.
If I manage it according to the way you tell me to manage it, then I can live a normal, productive life.
The great majority of people live completely normal lives.
That is great to know. Thank you so much for joining us. Now,
glad to be here.
We all have questions, so if we have questions more about asthma, how can we contact you?
We can be contacted at Stat Care Pulmonary. We have a couple of offices, and it's easy to find us. Most people these days find us on the internet, I must admit. So we have a number of us, and we're all happy to help take care of asthma needs and other breathing problems.
Yeah, and take care of all of the patients. Thank you for joining us this afternoon and for our brief talk on asthma. If you have any further questions, you can call Dr. Marty Prince. Good music, good food, good friends, and good health, right?
Right.
And that's a wrap.
Today's episode of Knoxville Medicine Doc Talk is sponsored by London and Amburn, attorneys at law, healthcare people, healthcare law. London and Amburn, attorneys at law, are proud to support the Knoxville Academy of Medicine and its mission to continue to improve community wellness in East Tennessee.